Hi, I'm Sal DiMercurio, the Director of Cosmetic Plastic Surgery Center. Today we'll be speaking about body lifts. We'll be doing the second part, part 2, and we'll discuss arms and thigh lifts. And for definition purposes, the arm lift is called a brachioplasty, and the thigh lift is called a thigh-plasty. And the word plasty in plastic surgical terms means to mold or to shape or to reshape. So a brachioplasty is reshaping of the brachial area, which is this area. First of all, let's make very clear that these are not procedures for weight loss. These are procedures to contour the body after you've achieved either close to ideal body weight or you've had a weight loss issue. The key factor with some of these are the laxity in the skin or the elasticity of the skin. The procedures are broken down to a variety of different levels. Let's first look at the minimal level, where someone doesn't require an excessive amount of skin or fat removal, and these could be addressed with non-surgical techniques like radiofrequency treatments, somewhat like microwaves. Don't put your arm in a microwave, not a good idea. But the principles are the same in that it's a controlled fashion to tighten the laxity in the skin. And this is good for a minimal improvement. That could be used both for the arms or the thighs. The second level would be a minimally invasive procedure where you would liposuction some of the fat tissue, and with a laser procedure you could tighten the under surface of the skin to some degree. This would be a minimal invasive because the incisions are very small and the amount that you would be tightening and removing would still be somewhat minimal. But in situations where you have much more tissue to deal with, either weight loss or excessive amount of skin laxity, then a direct excision is necessary. And these are the surgical procedures that we're going to focus in now. The surgical procedures for those really deal around removal of skin. If you have length issues, for instance, if you had length of skin between the brachial area along my sweater, along my jacket, coat, this length could be addressed with a crescent incision holding the tissue back up to the armpit. That would obviate a need for a long incision down the arm. If, on the other hand, you have issues with circumference, where the circumference of the arm is very large, then you do need to remove some of that skin, and then you do need a lengthening procedure or shortening procedure using a linear scar. These same principles apply to the thigh, and the length of that incision would have to deal with how much extra skin. Certainly we like to minimize the length of the scar when all possible, and minimize hiding the scars when possible. I prefer making the incisions for a brachioplasty in the lower part of the arm, very close to where it would not be noticeable in a front view or a back view, but obviously in an extended and supine hand view you might see part of the scar. And certainly the scars are visible, although we try to do our best to minimize them. Hide them first and then try to minimize the scar secondly. Scars sometimes do require revisions or sometimes in treatments to minimize the scar if they were to occur. Those are issues that we might discuss at a different session, but suffice it to say that we could sometimes use steroids or compression or silicone applications to try and improve the scars. These procedures are available and will be discussed in much more detail when you call us, and we tailor a private consultation where we'll go over all the details in a bit more of a focused fashion just for you. Looking forward to our next session. Salvatore DiMercurio, Cosmetic Plastic Surgery Center.